You know, here at KDZ Dental Arts, we do a lot of the KDZ Ultra. And the KDZ Ultra is a zirconia coping, just like a PFM would be, a metal coping, overlaid with beautiful powdered liquid ceramic, and we use Noritake. Now, a huge advantage of the Ultra versus just a monolithic zirconia is the depth of color, especially if we're working in the anterior. Let's say an anterior crown, an anterior bridge. You know, I consider premolars anterior teeth, so back to premolars. We get the advantage of a well-fitting material and strong materials in zirconia, relatively translucent or at least tooth-colored as a core, and then all this beautiful overlying ceramic. Now, the way the lab fabricates this is we go ahead and mill the zirconia coping, and we have a lot of options here. Let's say it's a mandibular molar where, or even a premolar, where you look in the patient's mouth and you see the entire crown, or the patient has a wide opening and you see the crown, you want optimal aesthetics. The lab overlays the entire zirconia coping with the Noritake, the powdered liquid ceramics. So we have optimal aesthetics because of potential depth of color. The ceramics will put dentin and enamel and translucent layers to maximize the aesthetics. That's how typically we do anterior crowns. Now, for situations in the posterior, we have some other options here. Let's say this is a first molar, a mandibular first molar, where the patient doesn't show much of the occlusal, or they have limited vertical opening, but we still want a nice aesthetics from the facial, or they're a bruxer and they're not going to wear their nocturnal appliance and they break all their teeth. We can actually design this so that what the lab does is they mill this coping so that it is milled to full contour on the occlusal surface, and then they can overlay just the buccal cusp. Now, the advantage of this zirconia has a flexural strength of about 1,500 megapascals, where the overlay has a flexural strength of about 100, which is similar to what we see with a porcelain-fused metal crown. So we can design this almost any way we want, especially in maxillary molars. What I do a lot is I like the aesthetics of a layered that we see in the Ultra. So what I'll have the lab do is they will mill the coping so it's full contour on the occlusal and my functional cusp. This would be my palatal side. So this is a functional cusp undergoing the most amount of stress. And then I'll have them overlay the aesthetic zone. So this is a non-functional cusp. They can overlay this, so this would be our buccal. They can overlay with all these beautiful ceramics, and we have some amazing technicians here. So I get the best of both worlds. I can have optimal aesthetics. I have a relatively translucent core in the zirconia. I have very accurate margins with the zirconia. I have a material that's 10 to 15 times stronger than a porcelain-fused metal crown, at least the ceramic portion, on a functional cusp. And this can actually be very conservative. The thickness here, I can have as little as 0.5 millimeters occlusal reduction. So I hope that clears up some of the misconceptions of why we would want to do an Ultra versus a traditional bruxer, and certainly the advantages of a zirconia supported restoration like the KDZ bruxer over a porcelain-fused metal crown.